Okay, great. Well, hello everyone, and thank you for joining today's webinar, Anytime Pediatrics Live Interpreter in Spanish app. This presentation will be recorded, so you'll all receive a recording of the presentation tomorrow, which you're welcome to view and share with others. This will also be an interactive webinar, so feel free to enter some questions in the chat, and we'll have some time for Q&A at the end. I'd like to start off by introducing our panelists today. We have Eileen Foley, our customer support specialist here at Anytime Pediatrics. Thanks for joining us, Eileen.
Hi, everybody. Thank you, Darby.
And we are also excited to have Jim Pastore join us today. Jim is the Director of Customer Experience at our partner CultureLink, and he has lots of experience in both healthcare and health technology. Thank you both for joining us. We'll go ahead and get started with Eileen highlighting the need for translation services in healthcare. Hi, Eileen.
Hi, everybody. So a quick introduction. My name is Eileen Foley. I'm a customer support specialist and the lead trainer with Anytime Pediatrics. So I'm going to go ahead and kick off this webinar by going over some studies that we found that benefit and show the importance of translation services. The first study for ethnic minorities is a study that was completed on the safety of healthcare for ethnic minority patients. They found that there were higher rates of hospital-acquired infections, complications, and adverse drug events and dosing errors when compared to the wider population. These issues were likely due to factors including language proficiency, beliefs about illness and treatment, formal and informal interpreter use, and also consumer engagement and interactions with health professionals. Language barriers and sick visits is a study looking at language barriers in a pediatric emergency department found that there were significant differences in test charges and length of stay when a language barrier existed and when it did not. The presence of a physician-family language barrier was associated with higher rates of resource utilization for diagnostic studies and increased emergency department visit times. Language barriers accounted for a $38 increase in charges for testing and 20-minute longer emergency department stays. So that would be more tests, x-rays, and other services. In cases in which a language barrier existed, that means test charges were significantly higher, averaging around $145 versus $104. And also emergency department stays were significantly longer, totaling around 165 minutes versus the standard 137 minutes. So what do moms think? From a mother's perspective, this study heard from limited English proficiency Latina mothers. They provided suggestions to help improve the quality of primary pediatric care for their children to better meet the needs of their families. Suggestions to improve the quality of pediatric care included encouraging providers to invest more in their relationship with families, providing reliable same-day sick care, expanding their hours, improving access to language services, and also improving care coordination services. So what needs to be done? We need to be consistent with the medical home model. Current efforts to improve primary care quality are relevant to this population, but they should really focus on the parent-provider relationship and timely access to care. Last, promoting this model to practices that serve limited English proficiency Latino families could really improve engagement and customer satisfaction with primary care. So since we went over those case studies, let's see how we can improve by showing you the Anytime Pediatrics live interpreter and also our Spanish app demonstration. So now I'm just going to go ahead and begin sharing my screen. And I first want to start off by showing what our Anytime Pediatrics platform looks like using our Spanish-enabled services for the entire platform. So one new feature that we are pushing out next week for Anytime Pediatrics is we will have the Spanish language services optional for all of our Spanish-speaking patients. To enable the platform to be entirely in Spanish, what any user can do is right here, they'll be able to select their desired language preference. It will default to English, but by switching to a simple Spanish translation, the entire platform will then be in Spanish, so all of your patients will be able to use Anytime Pediatrics in their desired Spanish language services. Next, I'm going to show you how to use our live translator services on the Anytime Pediatrics platform. So I'm just going to go ahead and turn it over to my clinical account so I can log in. And I'm going to hand it over to Darby Tingu, who will be popping into my waiting room. That way I can show you how to easily enable our Spanish language services during a live visit using Anytime Pediatrics. That way a translator will come on the line and they'll be able to easily interpret the entire conversation with your Spanish speaking patient. To kick it off, you're just going to start using Anytime Pediatrics to enable the telemedicine visit. So I'm going to click on steps 1 through 3 to begin the virtual visit with the patient. All right, thank you very much, Darby, for hopping into the waiting room. So with Anytime Pediatrics, you can easily use our interpreter services to bring a live interpreter on the line with you. So to enable that service, all you would do is select the language. So we can select Spanish for this demonstration. And then you would simply just click Call Translator, and a live translator will come on the line and they'll be able to communicate with you and your patient. That way, the translator will be there to easily make the telemedicine experience as smooth as possible with your patient. And if there are any issues or any technical questions, you can easily resolve them with the translator on the line, and just be rest assured that your patient will receive high quality care from your pediatrician's office.
All right, Jim.
Well, thank you everybody for joining. A little quick introduction. I've been providing services in healthcare with interpreter services in healthcare since 1998. So I've seen a lot of changes over the past 20 years. And it's very interesting how telemedicine has really started to come into the forefront as far as treating patients through that type of platform. We've been providing remote interpretation now for, like I said, over 20 years. And what I'm going to speak about today is why do we need to use an interpreter? So we can move on to the, are you doing the slides, Darby?
Yes, that's right.
Okay, we can go to the next slide. So some of the reasons why you need to use an interpreter is you know, as Eileen stated, there's been a lot of studies, and there's been a lot of discrepancies in healthcare outcomes, you know, with patients not receiving proper care because of the language barriers that they run into. And we notice that there are a lot of on the discharge rates that the non-English speaking patients are in the hospital much longer, and that costs everybody more money. So if we can communicate, we can save money not only on the caregiver side, but also on the patient side. So it's very, very important that we communicate properly in a language that they can understand. We can go on to the next slide. So in understanding what an interpreter does and what they do in an interaction is the most important things is an interpreter's job is what we refer to as the 3 C's. First and foremost, they're a conduit. They bring the information back and forth from the caregiver to the non-English speaking patient. They're a clarifier. If the interpreter notices that the patient may be nodding his head yes, but they really don't understand, they're going to ask the doctor or the caregiver in that interaction to please clarify the situation. The patient may not understand cardiac catheterization, so that the caregiver has to explain it at a level that they can understand. Also, they're a cultural broker. They understand the cultures of different aspects in dealing with patient care. For example, a young child in Los Angeles had red welts on his back. The doctor was concerned and wanted to call Child Protective Services because he thought there might be abuse. The interpreter jumped in and helped the doctor understand that this was a cultural issue where the parents run a gold coin down the patient's back, down the child's back, to remove the evil spirits. So there wasn't abuse, it was actually an in-home remedy. And so using the interpreter is very, very important, and how to use it. You know, the interpreter needs to be transparent to the situation. The interpreter needs to be able to see the patient, because the 80% of communications is nonverbal. You need to, the caregiver needs to speak directly to the patient, not to the interpreter, in first person, in short phrases, and speak to the level of the patient. So that's very, very important, and not only using an interpreter, but understanding how to use an interpreter properly in this situation. And we can move on to the next slide. So there's a few tips. We want to address we want to speak directly to the patient. We don't want to say, interpreter, can you ask the patient what his name is? Because the interpreter will say, if they're doing their job properly, is, interpreter, can you ask them what their name is? You want to look directly at the patient and say, what is your name? How can I help you? So we don't want the interpreter to dominate the conversation. So we want to insist on speaking short phrases and go sentence by sentence. We don't want to discuss multiple complex issues. We want to limit the key points to three or fewer key points to keep everybody focused on it without getting lost in tangents. We don't want side conversations going on. Interpreters, if they're trained properly, know all they need to do is be that conduit, take the information back and forth, and only step in to clarify or bring in cultural issues, but they should not be having side conversations with the patient. We don't want people to say, my Spanish is good enough. You always need to use a qualified medical interpreter, certified or qualified, in an interaction when you're discussing anything clinical. Because the biggest issues is there's omission. You don't know how to say a word. So it completely comes out of context. So you want to use a qualified professional interpreter whenever possible. And with services such as CulturalLink, that makes it very, very easy to happen. And that's why Anytime Pediatrics has now included this in their platform. You can use, you don't always want to use the interpreter to witness a consent form. You want an uninvolved party to witness it with the interpreter in the conversation. And first and foremost is we don't want to use family or friends as interpreters, because family, unfortunately, make the worst interpreters. They will withhold information. And some of the cultures don't allow children to speak to elders about serious medical issues or bring up information like that. So using an interpreter whenever possible is the way to go. We can move on to the next slide. So one of the things I work with when we set up training and teach people how to use interpreters is understanding that an interpreter is a trained and skilled professional. They have many attributes that they're trained on. And one of those most important things is memory skills. An interpreter in their language can handle about 65 words. In the target language, they can handle about 25 words. So it's very interesting in working with doctors and teaching them how to use interpreters properly, is I would do a question for them and ask them to repeat after me in English, where I would say, good news, your ankle isn't broken, it's only sprained. I want you to take 2 Lortab every 4 hours. And every 2 hours, I want you to raise your foot up above your heart on the couch in an elevated position. And Nurse Jackie is going to come in and teach you how to use your crutches. And ask the doctor to repeat that back in English. And they usually get about 4 or 5 words into it and start changing it. An interpreter is a qualified and trained individual to repeat word for word verbatim. So it's very hard for other people to be an interpreter if you're not trained. And again, as we bring up, as I spoke before, saying my Spanish is good enough. It may be good enough for you, but it's not good enough for the patient. And that's very, very important. So that's something that you can try and think about, that is to listen to somebody speak and then try repeating back exactly what they say. And it's very, very difficult unless you're trained on how to do that. So it's important to understand the role of the interpreter and what their skill set is, and really depend on them to bring across the proper communication when dealing with somebody who doesn't speak English. So we can go on to the next slide, Darby. So a few stories, and then we can open this up to questions. There's one of my favorite stories is I ask people that we're working with is, how do you spell once? And we all know how to spell once as O-N-C-E, but most people don't know how to spell 11 in Spanish, which is O-N-C-E. So thinking about one simple word like that can make a huge difference in the outcome for the patient. If they go home with a bottle of morphine tablets and the only word they understand is 11 in Spanish, when they're only supposed to take that tablet once a day and they take 11. So one simple word such as once or once can change the outcome for a patient dramatically. And a lot of people, just think, well, we need to speak English. Well, when children speak English and they use children as interpreters, such as the child in Los Angeles who was asked to tell her mother they were going to give her an MRI. And she said, "Mom, they're going to microwave you." Interesting stories. And the one I'll leave you with is the most famous story for interpretation is the $71 million word. In Florida, a female brought her significant other into the emergency room, and she was trying to tell them that he was dizzy and didn't feel well. And the only word that she could think of was intoxicado. So they pretty much thought that her significant other was inebriated or drunk. And he actually had a brain aneurysm, is now a quadriplegic. And they won a lawsuit against that facility for $71 million because they didn't use an interpreter properly. They used one word from the person who brought them into the emergency room and misdiagnosed the issue and changed the outcome of that patient forever. So there's all kinds of those stories out there, but bottom line is use a qualified, trained medical interpreter for any clinical interaction. It's very, very important, not only for the caregiver and for the patient, but for everybody involved. It shortens the time that the patients are being dealt with. It shortens the costs. It makes everything more economical when you use a qualified medical interpreter so the information is being passed properly. Thank you very much for your time, everybody. I'll pass it back to you. Thank you very much.
Thank you so much, Jim. That was very interesting. I'm going to hand it back over to Eileen just to show everyone a little bit more in depth of the Anytime Pediatrics Spanish app. So I will stop sharing and hand it back over to Eileen, and then we'll have a few minutes for questions at the end.
Thank you, Darby, and thank you very much, Jim. So I'm just going to go ahead and share my screen again. So this is the Anytime Pediatrics web platform using the Spanish translation services. So just by selecting Spanish, if I'm a new user, now I understand, since it's in my language, exactly how I need to register or log into my existing account. So I'm just going to register now with my email address and the password I created. And then here's where the patient will easily just create their account. So I'm going to go ahead and create my account. Notice that everything is in Spanish. All the required fields are in red. So this patient will be able to easily register properly for their account. Here's where they'll add their 4-digit practice code. And here's where they'll add their child's information. And now I'm just going to quickly show you what it will look like when a patient that is using the Spanish version of the web platform requests a telemedicine visit. So as you can see, everything, all the directions are clearly in Spanish, making it so much easier for the patient to be able to use Anytime Pediatrics and connect with your pediatrician's office for a telemedicine appointment. Once they choose their main reason and their main concern for the telemedicine visit, here's where they would just simply be able to enable or disable their camera and microphone, make sure that everything is working properly, enter the required wait for their patient, and then they would easily be able to accept the terms of service and the consent to treat, and they'll pop right into your waiting room. Even the chat, everything is in Spanish. So we just have worked so hard on this to make it even easier for all of your patients, whether they speak English or Spanish, they have that same trusted care from Anytime Pediatrics and your pediatrician's office.